Welcome back to the show. Today's guest is Dr. Staci Whitman, and she is a functional dentist as well as an airway specialist, which is kind of rare in functional dentistry and also really special because I think we're starting to see that many of our oral issues and recurring cavities and oral microbiome issues are directly related to actually the way that our jaws are developing or not developing properly, which makes a lot of sense with our mineral depleted soil and diets. All of this to say, Dr. Staci Whitman has an incredible educational background, an incredible multifaceted skill set, and is really able to give us this holistic picture of what makes or breaks your oral health and how to prevent things like cavities and root canals and keep your mouth in really good shape for many, many years, since these are the only teeth we got. We're going to talk about a lot of different topics today and bop around because she's a really fun personality. And she's going to share her fluoride journey with us because she was once picketing in the streets for water fluoridation until she had a professor in dental school who walked in the room one day flabbergasted after just listening to a fluoride debate and hearing some more of the science that's not always popularized in the modern educational curriculum in dental schools. And he walked in, again, flabbergasted, totally mind blown with what he had just learned, and encouraged his students that day to look deeper and listen to this debate that he had just heard. And her mind was forever changed on fluoride, and she switched over to Nano hydroxyapatite, which I'm sure is an ingredient that a lot of you are seeing in holistic or natural toothpastes nowadays, and you may be curious about. And you might have questions like, hey, is this actually equivalent to fluoride? Is this actually going to protect my teeth and my kids' teeth? Like, I don't want to make a grave mistake here and go too crunchy and then, screw over my kids' oral health. So that's a very valid point. And we talk a lot about the mechanism and the science behind Nano hydroxyapatite and why it's actually a wonderful alternative that really stands up scientifically. We also talk about things regarding fluoride that I didn't know, like how it actually works and how it can mess with your enamel over time. We're going to talk a lot about mouth breathing and how to understand if snoring and mouth breathing is affecting your oral health, like signs to look for. We're going to talk about the oral microbiome and our hormones and fertility and how dysfunctional oral health, recurring cavities and just a dysbiotic oral microbiome can actually create a level of inflammation in the body that can throw off your hormones and can even make it hard to get pregnant. So I thought that was really helpful because maybe if you're someone listening who has been trying to conceive for a while and you're doing everything right and hitting a wall, this could be a place to look and just take tiny, tiny steps to optimize, like oil pulling or switching your toothpaste, all those things. So I felt that it was just a nice combo, kind of reminding those of us who already have a bit of an idea of holistic oral health of the things that we should be doing and kind of like the whys behind it so that we can get back on our game. And for those of you who are just starting to learn more about a holistic view of oral health, this is an excellent full picture, big picture, zoomed out bird's eye view of kind of everything you need to know on how to keep your mouth healthy, how to remineralize your teeth, how to prevent cavities or reverse them in the early stages. And I hope you guys love it. I love a little educational episode. I love the oral microbiome. I mean, it matters so much for your gut health. You're swallowing your oral bacteria all day. And I think a lot of times when people are having recurring gut infections, it's actually coming from the mouth. So this is really a root cause episode, and I hope you find it helpful. Thank you as always for listening and for being on this ride with me and for rolling with the punches with the different episodes that I bring you each week, where one week I'm going off the spiritual deep end and now we're talking about teeth. Love ya. See you soon. Okay. Are you ready?
We feel each other's emotions.
It's everything. It's living my life intentionally.
That's the message, right?
Absolutely. There's no difference between our mental health and our physical health. It's the same exact thing.
And without further ado, let's get juicy. Welcome to What's the Juice podcast, Dr. Staci.
Hello, Olivia. I am so happy to be here.
It's such an honor that you came all the way out to the suburbs today for this podcast on functional dentistry. We were just talking in my kitchen about how we really need more functional dentists in the world and how hard it is to find a good dentist.
Yeah.
And how your mission kind of in life and like why you became a pediatric dentist even is because you were seeing so much oral dysfunction and disease that you were like, I need to figure out how to stop it at the root when people are young so that we can kind of stop this silent epidemic.
100%.
So
yes.
Walk us through that a little bit.
Yes. Again, thank you so much for having me. It is absolutely an honor. I just love what you do, and thanks for being here. I was a general dentist. I was classically trained, if you will, in a very traditional setting, as we all are, and we need to be. But I practiced in the general dental environment for a while, and I really found I was not happy with my career choice. I found a lot of dissatisfaction going to work every day and just putting out fires. And whether that was cavities or gum disease or what have you. And I just thought, gosh, there has to be a better way. I didn't feel like I was really improving the health of my patients, and my sense of purpose was lost. And so I almost left dentistry, and I was trying to salvage my career as best I could. And I thought, well, how can I do this differently so I feel like I'm making an impact and really changing patients' lives? And that comes with root cause approach. And that's the functional approach. But I thought, well, gosh, how do I get upstream? Children, education, educating parents, because we do know if we start hygiene early, dietary education early, talking about the microbiome, how we breathe, all these things we'll get into. If we start these educational moments early in life, we really can prevent all of this disease that we speak of in dentistry and set a child, patient, and ultimately their family up for success and for health. And so I just started looking at oral health differently and looking at the mouth differently and looking at what I did and my responsibility daily differently. And so I started practicing it with a more functional mindset, and it has been such a blessing, and it really has changed me as a provider in my practice, and I really feel I'm making a difference. So I feel my sense of purpose is more fulfilled.
What was that light bulb moment for you when you were like, the tooth is connected to the knee bone? Like, you know what I mean? Like
Yeah.
the tooth is connected to the body, and this is part of our entire picture of health.
Yeah, there were a few, but one in particular I remember very vividly, a patient who came in, and this revolves more around emotional health. And every time he came in, he had a cavity or periodontal disease. He just wasn't taking any of the recommendations we made. But honestly, I believe it's because we had never found a way to empower him to take care of his health. A lot of traditional dentistry is you spend very little time with the dentist. You have very little time to actually educate and unpack what's going on in that patient's life. But he came in with such phobia and fear. And so to me, it was more connecting the mouth to his emotional health. He also had metabolic disease, uncontrolled diabetes. And, I had to learn and re-educate myself on some of these things. But now in hindsight, a lot of those were not being managed appropriately because of his oral health, dysbiosis and dysregulation. And for me, always the foundation of my practice is emotional health of my patients and making sure there's never shame or judgment, because ultimately it's an education issue. And so many families, just in patients and all the listeners, were just not taught a lot about oral health and how it is connected to the rest of our body. Unfortunately, medicine's gone one way, dentistry's over here. And that's created this idea that they're separate, and we really need to get them connected again. And so that's where functional medicine and functional dentistry collaborate together. But I do think there's so much fear and phobia and shame around people's oral health, and we're really trying to correct that. And I like to just take a really loving approach because we're all just doing the best we can, every day. And so little changes can have really huge impacts.
Do you think it's just a reflection of the way that Western medicine has gone as a whole, that we see everything as so separate? Because it is so funny that we kind of cut off the head at the shoulders and say dentistry is over here. Your teeth are one thing that just need to be almost like topically treated almost.
Yeah.
And then the body health is over here. When in reality, like you just said with the metabolic disease connection, by improving the microbiome of that patient's mouth, by improving their oral health, they might actually see some metabolic improvements in the rest of their body because it's all connected.
It's all connected. And inflammation is one of the big triggers too. The oral microbiome, the toxins that they release, components of their cell wall, if you have pathogenic bacteria, can lead to inflammatory responses in the body. And we know that these bacteria in our mouths, they don't stay in our mouths. They can travel all over the body, through our vascular system, through our lymphatic system, and they can wreak havoc with inflammatory disease downstream too. So it is important, vision is the same way. We separate our eyes too. And so a lot of this is just it's insurance based.
Yeah.
But unfortunately, because of it, people give their teeth an afterthought and they give their eyes, just look at it as an afterthought. But I see the movement happening. I think, the mouth really is the gateway to our health. I know you have some Chinese medicine training. What do we look at? We look at the tongue. We look at the color of the lips and the gums and the mucosa. You can tell a lot about the health of a human from what is happening in their oral cavity. And I think I'm seeing a movement. People are starting to pay attention and understand that the oral health, but specifically the oral microbiome, is critical for our entire health. And I do think this is where our functional medicine colleagues are stepping up a bit more, but where we've missed an opportunity because we're really focused on metabolic health and gut health and all of these things, biohacking, prevention. But what I see very much lacking in a lot of these programs and discussions is what is happening in the patient's mouth. Because you can try to clean up the gut and the parasites and the H. pylori as much as possible, but if they're still residing in your mouth and you're swallowing 2,000 times a day, you're really going to have a hard time reaching optimal health. And that's where oral microbiome testing comes in, working with a very knowledgeable provider for targeted, personalized medicine, essentially. And that's where dentistry, we've missed. There's no personalized medicine anymore. We kind of treat every patient the same, generally speaking. And I really look forward to a time where we look at the patient as an individual, because I think that's how we're really going to achieve optimal health.
So you're saying conventional dentistry is more, there is a cavity, let's treat and fill it, end of story. Whereas functional dentistry is, let's look at why you're coming in with a cavity every time. Let's look at why you're grinding your teeth.
Exactly.
Let's have a relationship with you and spend time with you while you're in this chair so that I can explore with you some of the reasons why that might be happening and maybe even refer you out to other practitioners that can do some further digging.
Yeah. Yes, exactly. So I do believe there's sort of there are dental technicians.
Yeah.
And then there are dental almost physicians. And I hope the industry goes that way. And I think we need both. We always need a dentist that can fix the teeth and fix the issues. But when a patient comes in, and I do focus on the pediatric population now, but I have knowledge about this all overlaps, right? This is applicable to adults as well. But for me, it's less about the tooth and the diagnosis of the cavity and more about the why, as you mentioned. Because if I don't help the patient understand that and address that, they're probably going to have disease again. And ultimately, that we're supposed to be ending disease. Yeah. And especially with all the links to gum disease and periodontal disease, to downstream effects, how it impacts brain health, Alzheimer's, mood disorders, cardiovascular health, fertility, our hormones, our sleep, our mood. There's some big impacts that these bacteria, these viruses, these protozoa, the yeast in our mouths, how it can influence other systems of the body. But if I don't take the time to explore that with that patient, I feel like I'm doing a disservice. So I hope to see dentistry become more specialized in focusing on more of the medical, bio-individual, personalized medicine component.
It's funny how we'll do all of like the gut testing and take all the supplements and make the diet changes, but we won't enact an oral routine.
Well, and exactly. And this is what I see. There's more and more functional medicine diagnostic companies popping up, which I think is really cool because of the access to care. So you can go and you can get your organic acid test and your gut mapping and your blood draws and all of that. But no one's testing the oral microbiome too.
No.
And so I would love to see that for anyone listening out there. To be part of it. We should be testing our oral microbiomes just like we do gut mapping too, because my oral microbiome is influencing my gut.
Mm-hmm.
And so you can take all the herbs and remedies you want and do anti-parasitic cleanses and moon cleanses and all of these things. But if I'm not dealing with the dysbiosis in my mouth, my gum disease, my periodontal disease, my mouth breathing, whatever's happening up here, I think we're just going to be at a loss. We're just never going to actually get to the finish line.
Never going to clear the thing. For so many people, their SIBO comes back.
Yes, absolutely.
Time and time again.
Yeah.
And it's like, we're not looking at the fact that our saliva can be seeding that.
Yes, it does. All day long.
We're just constantly swallowing our own bacteria.
Yeah, and we're learning more and more about this. I mean, it's a cool time to be alive in dentistry, I think, because of how much oral microbiome research is happening now.
Yeah.
But if you're a functional medicine doctor out there, I really do encourage you to look into oral microbiome testing or working with a functionally minded, whether they call themselves that or not, but a dentist, because I think you need both. You absolutely do.
Do you think it's safe to say if someone has gut dysbiosis to whatever degree, whether it's bacterial, fungal, parasitic in nature, that there's some degree of dysbiosis in the mouth because they're so intricately connected?
It's super bidirectional. Yeah. So we call them kissing cousins. They definitely influence each other. There's the oral gut axis. And so we do see patients who have a lot of oral dysbiosis. They're more prone to IBS and we see Crohn's and celiac. I mean, a lot of times dentists are the first that can diagnose Crohn's and celiac because we see oral ulcerations or fissuring of the mouth long before there's general body or systemic signs too. So I think we have a really important role of putting these connections together. But unfortunately, we were speaking about this earlier, dental school is very overwhelming. You know, we're trying to learn a lot of the medicine and didactic components, but then we're also learning how to manage a handpiece and do a filling and do a root canal and these very technical things. And there's just not a lot of space in the curriculum to connect the dots from a more medical approach. And that's where I would love to see more functional dental curriculums popping up soon.
Oh, yeah. Okay, so you said this bidirectional relationship, this mouth to body relationship. And bidirectional means that, you know, some kind of imbalance in the mouth can perhaps directly cause imbalance in the body, and vice versa. Imbalance in the body can cause presentations of dysfunction in the mouth.
Yes.
Can we get specific on a few pieces of this? You mentioned hormones earlier. Can our oral bacteria and our oral environment actually affect our hormones?
It can. I mean, it's inflammation. So stress, think cortisol. Cortisol impacts and leads to inflammation in the mouth. So if we're very stressed, we're clenching our teeth, cortisol is being released. That affects gum health. That can affect periodontal health. That can lead to bone dysregulation. But also, you know, perimenopause and menopause, progesterone, estrogen. This affects how our gums are behaving, our collagen synthesis, and inflammation as well. And bone dysregulation too. So we tend to see a lot of bone loss around perimenopause and menopause. And so a lot of women come in with more periodontal disease. They get their probing pockets. Maybe you've been at the dentist and they're like 3, 4, 5. You know, we want to see 3s, maybe 4s. Once they get deeper, that means we have attachment loss. We've lost ligament attachment. And so if we could support women through that journey with an oral health spin, like how do we support ourselves nutritionally? How do we support our hormones, you know? And I love that hormones are really blowing up right now and that this is becoming more of a topic to support women through these different phases. But it does impact your oral health too. You know, it can impact fertility, your ability to conceive. So there are more open-minded and progressive doctors now in fertility clinics testing the oral microbiome, not only of the mother, but the father too. Because again, these toxins that these bacteria can release, the inflammation that they can cause, they can affect our ability to conceive. They can affect sperm mobility and sperm motility, and they can affect our actual pregnancies as well. They can lead to, we see periodontal disease, like P. gingivalis specifically is a bacteria we see in periodontal disease a lot. It can impact the birth of our children. So preterm births, low birth weights, even some negative pregnancy outcomes. So periodontal disease is something, if you have it, you want to manage it appropriately. It is chronic inflammation in the mouth. It's an inflammatory process. And what happens in the mouth doesn't stay in the mouth. So if you have this inflammation going on in your mouth, you have inflammation essentially everywhere. And it's oxidative stress essentially. So how do we clean that up in the system?
What happens in the mouth doesn't stay in the mouth is just my new tagline. I'm going to just tell myself that every time I'm flossing. This is so important, what you're saying. The way that bacteria specifically in the mouth, whether it's P. gingivalis, whether it's any other sort of overgrowth of bacteria that might be wreaking some havoc in your mouth, how that directly leads to molecules that cause body-wide inflammation. You mentioned earlier the bacterial cell wall actually causing, like, wreaking some havoc in the body. Break that down for us into layman's terms, because I know of that as like LPS, lipopolysaccharides.
Yep.
For those who aren't familiar with this topic, like, tell us the mechanism of exactly how that bacteria is causing that inflammation.
Yeah. So just think toxin load. So our bodies do not like a lot of those pathogens. We naturally, generally, all of us have about 5% of our oral microbiome will be composed of pathogenic bacteria. Once it starts to get up to 45, 48, 50%. Now the biomass, our biofilm is more pathogenic, and it's inflammation. And so what are those inflammatory markers? Like C-reactive protein will be increased. But essentially there's components of the cell wall that break down that act like a foreign body, and our body reacts to that with an inflammatory process. So we don't want a lot of these pathogens roaming around our bodies because we react as an invader. Yeah. And it's not ideal because of the inflammation. And they can cross the blood-brain barrier. We're seeing the issues with Alzheimer's patients too, and the plaques that we're seeing because our body just is reacting, rejecting this being in that area. We know it's not supposed to be there.
So basically, when you have the correct or like a healthier ratio of, let's say, 5% pathogens to 95% good bugs, your body, like, the thing is that all of these bugs reproduce and die constantly, right? They're constantly spawning new bacteria and reproducing, and then they're constantly dying, and we constantly have to clear the actual dead bodies, let's say, of this bacteria.
Through swallowing.
Yes. And through, like you said, even our bloodstream, right? If there's like a leaky membrane in the mouth and they get into the bloodstream.
Leaky gums. Yeah, we can talk about that.
So when that figure of 5% pathogenic bacteria gets up there, and like you said, maybe there's a situation where someone has 50% pathogenic bacteria in the mouth and 50% probiotics or good bacteria, that means that 50% of bad bacteria is reproducing and dying, and we're needing to clear those bacterial cell walls that have now died. And because they are foreign pathogenic invaders, the body has a much higher load of lipopolysaccharides or bacterial cell walls to clear that are basically viewed by the body as toxins because they are pathogens.
And taxing the body constantly.
Yeah.
Yeah. It's just like when you have maybe chronic tonsillitis, or any appendage in the body that's creating inflammation, your body's putting all of its energy into that on a daily basis. And so this is what happens with gum disease and periodontal disease and the biofilm in the mouth as well. Your body's having to work overtime and so hard to clear that, to make sure that the inflammatory load is lessened. But you mentioned the leaky gum thing. I think that's really important. We talk about leaky gut, But if your gums are bleeding, that's now an entry point for bacteria in the mouth to enter the bloodstream and the lymphatic system. So we say, if you brush or floss, there's pink in the sink. That's not ideal, that the integrity, the epithelial lining has been broken and damaged. And so you're really setting yourself up for more systemic issues that way. So we want really healthy gums in our mouths. It's critical. And I think, unfortunately, some people just think my gums bleed, no big deal. But I don't think we'd say that about any other part of our body if we just kind of spontaneously bled. So we want a low bacterial load. These pathogens also, they impair the minerals in our mouths. They change the pH, the buffering capacity. And so we want a more neutral or alkaline pH in our mouth, but these bugs produce acid. So we're in this constant state of a lower pH, which tends to leach minerals out of our teeth. It impairs ion exchange and immune function in the saliva too. So I want everyone to think of their saliva as this golden elixir that helps with immune function. It has so many ions and minerals in it. And when we're in perfect balance and harmony, everything's working properly, so that we shouldn't have demineralization of our teeth. These cavities shouldn't form. But when you brush and floss, what you're doing is disrupting this biofilm. And so if the biofilm is filled with more pathogens, we're more at risk for mineral deficiencies, pH imbalances, and then inflammation as well.
Something that I've uncovered in my health journey personally is that a big trigger for me when I start to cross that line of like feeling good and feeling well to feeling inflamed and, things are going downhill, it's when I'm not keeping my bacterial load down. And to your point, there's like a two-prong issue with a higher bacterial or pathogenic bacterial load. One is, like we said, that bacteria has to die and we have to clear those cell walls, and they are basically an inflammatory burden on our system that we have to clear. But also that higher population, that higher load of bacteria has to produce its own waste products by living, just like we as humans produce our own waste products. And those waste products are acidic.
They're acidic, yeah.
And eat away at our teeth.
Yeah, you hear some dentists saying this to children. I personally don't use this language, but that the bacteria, they poop. And that it's that excrement, which is acidic, which is leaching the minerals from your teeth. So I try not to explain it that way to kids because that's just really gross. But it is true. It's their waste products that are causing the problem.
And this is a good explanation. Like, these two factors alone are why gut dysbiosis can wreak so much havoc on us, and also why oral dysbiosis can wreak so much havoc. So if a big goal in functional dentistry is to bring balance to this oral microbiome and have a lower bacterial load in terms of pathogens and a higher bacterial load in terms of happy good bugs,
how do we do that?
How on earth do we do that?
How do we do that? Unfortunately, dentistry has missed the mark again, I think, because we're so focused on killing. Kill, kill, kill. So you see these products that say kills 99.9% of germs. We want to change and shift that mindset. We want to be nurturing and feeding and crowding out the bad bacteria. We want to nurture and feed the good bacteria. So how do you do that? Well, it's what diet do you have? Do you have a high vegetable diet? Prebiotic fiber is really important. Are you eating whole foods or are you eating ultra-processed foods? What many people don't realize is pathogenic bacteria, they love sugar. We know that. But sugar doesn't only mean candy and soda. Sugar actually can mean flour. So crackers and chips and pretzels and granola bars and all those hyper-palatable foods that so many of us love and are meant to be snacked upon, those are feeding those pathogens. And I notice too, if I eat something like that, you'll feel that film on your teeth. That's the biofilm. And that is very likely an unbalanced biofilm. So we want to be, prebiotic fiber is huge. How we're breathing is huge too. And I think we'll get to that in a moment. But when we breathe through our mouths, if we're mouth breathers, we're changing the environment. We're changing the terrain. Our mouth dries out. We lose all that healthy saliva, and it sets up this perfect environment for these pathogens to thrive because they love acid. You know, they thrive in acid. Hygiene's important, of course. What you're really doing with brushing and flossing or water picking or tongue scraping, any of those things every day, you're disrupting the biofilm. What's cool about the mouth is we have access to our biofilm.
What is a biofilm?
It's the layer of plaque of bacteria, that sticky, cohesive layer, that film that you feel, that's a biofilm. Now, there can be benefits to the biofilm. It can have protective benefits like mineral exchange, you know, putting in calcium and phosphorus back into our teeth during an acid attack. But it can have negative impacts too, depending on the makeup and the composition of it. So the bummer is the biofilm always comes back, but how it comes back and the integrity of it is really dictated on our diet and what we're feeding it. So this is why at my office, we talk about eating the rainbow. It's a big theme. It's because I want the children to learn that these rainbow foods are feeding the good guys. That's our phrase at my office, is feed the good guys. But unfortunately, so many of our dental products, they're just too harsh. And they're not selective. So that burn, those foams, those astringents, those alcohols that we're using in mouthwashes and toothpaste, the emulsifiers, their surfactants, they're very oral microbiome disruptive, but they're not only just targeting the pathogens, they're damaging our commensals or beneficial bacteria too. And commensals, I want you to think, are kind of like our party bugs. They just hang out with us all the time. They don't really do any harm. Sometimes they do good, but they're net neutral. We want a lot of commensals. We want a lot of beneficial bacteria. And I remember once having a professor explain it this way. If you walk into a movie theater and every seat is filled with a beneficial bacteria, there's nowhere for you, the pathogen, to sit. So you don't want to leave space for the bad bugs. And so you can also implement probiotics. They have oral probiotics, but you just really want to create this optimal environment in your mouth so that the bacteria don't get above that 5%. We don't mind a few of them there, but we don't want them to overtake.
This is really reminding me of episode 1 of this season with Dr. Alexis Jasmine, where she talks about gut overgrowths and SIBO and just intestinal imbalances and digestive symptoms in a no-kill kind of lens, where her approach, instead of, massive SIBO protocols with antimicrobials, which can be helpful for like a very short period of time, I think, to just cut that bacterial load down a little bit before you start feeding, so you don't feed the wrong things.
Yes.
But her approach in general is to feed your good bacteria with red plant pigments, with HMOs, other prebiotic fibers, in order to crowd out the negative pathogens and just not give them a chance to come back and thrive and survive. And that's exactly what you're saying for our mouth. You're saying that while the conventional wisdom, if one is listening and is aware that they might have some bad bacteria in their mouth, would be to just go out and get Listerine because it says it kills 99% of germs. That is not actually, that is such a temporary, like 5-minute solve that is going to maybe clean your mouth of every type of bacteria for a few minutes.
And you don't know what's going to come back.
You don't know what's going to come back. And I remember a few years ago reading some research showing that when a surface, I think it was a surface, when a surface was disinfected with a Lysol-esque material that killed 99.9% of germs, it was actually easier for pathogenic biofilms to then stick onto that surface after, because they kind of had a clean slate to do so.
So clean.
Yeah.
New opportunity.
Too clean.
Yeah, we're learning so much more about this and how they all interact. And we do know at some degree a pathogenic bacteria serve a purpose in us. But yeah, you don't want to over clean your mouth. I mean, and that's where so many of our toothpaste they burn, that strong mint, all those essential oils, that foaming. I mean, it's really stripping away everything. And we don't know what type of environment is left behind and what type of pathogens will survive and take over. There's some preliminary research to say it really makes it more inhabitable for pathogenic bacteria, as you mentioned. So it's a mindset shift. I explain to patients, think about when maybe you switched your deodorant. You moved away from the aluminum deodorant into the more natural deodorants. There was a transition period as your skin microbiome adjusted. Sometimes we were a little fragrant, perhaps, or when we have learned to not wash our hair so much and strip all those oils and use shampoos that don't have all that sodium lauryl sulfate and that foaming. There was a transition period where my hair, at least, was kind of oily, and I just had to kind of get through it as everything readjusted. It's the same with your oral care products. We are so used to just carpet bombing the mouth. But as you move into cleaner products, you'll find some patients just say, wow, it just doesn't feel quite as clean as I'm used to. But I just want to say, rest assured, you're serving your microbiome and your microbiome's happy. We don't want to be wiping out the commensals and the beneficials too. And so it can just be an adjustment period.
Yeah. In the short term, when you finish a little Listerine swish, it might feel very satisfying to run your tooth along your teeth, not to run your tooth, to run your tongue along your teeth.
I got you.
And
squeaky.
Yeah. And you're just like, ooh, it's squeaky clean.
There's not supposed to be squeaky.
And you're not supposed to, because that means that there's absolutely zero presence of good bacteria, good biofilm. Like you said, we kind of need some level of biofilm.
We have to. There are more of them than us. We're far outnumbered. We are our bacteria. I think this also is being spread about more. People are more aware that we're more bacterial DNA than, human DNA.
It's better to work with it than try to fight against
100%.
It when you realize how much.
And with a lot of those mouthwashes too, there's data and studies to show that it's stripping our nitric oxide producing bacteria that affects cardiovascular health. It can potentially raise blood pressure. There's links to erectile dysfunction because of the reduction of these nitric oxide producing bacteria in the mouth too. So the bacteria serve a purpose. We really don't want to be wiping them all out. And again, I'm really excited about the research. But until we know your oral microbiome makeup, it's really hard to have personalized diagnostics and personalized recommendations, which is where currently many progressive dentists, they're testing the microbiomes of their sick patients, which is wonderful. But I look forward to the time where we just test every patient just to get a baseline.
So it sounds like the number one strategy to balancing your oral microbiome and keeping bacterial load down is to increase your population of good bugs so that they can crowd out the bad bugs. And I just want to really reiterate that, because I think the kill strategy is becoming so outdated in both the gut and the mouth, and functional medicine is catching up. And it's the same phenomenon that happens with like minerals and heavy metals as an example. A lot of times people want to do like a heavy metal detox or use chelators that are going to force heavy metals off of receptors in their tissues and hopefully get rid of them. But a much slower and more effective nutritional way to accomplish this is to simply consume more of the good minerals that bind to those same receptors and will kick the heavy metals off.
Yes.
So it's a very similar phenomenon.
It's a friendlier way to do it.
Yeah, it's really a similar thing to what's happening in the mouth, is that the more you're supporting the good bacteria, either by stopping the killing of all bacteria, right? And then also eating a healthier diet, eating more prebiotic foods and more colorful foods, the more you will slowly start to feel your oral microbiome shift, even though at first your mouth might not feel quite as clean.
It'll be in a transition period.
Okay.
Yeah, but stick with it. Yeah, we are over disinfecting. I mean, I would add to that, we're over disinfecting our homes and, in our clothing, and we're seeing asthma and allergies and eczema increase so much. And I'm seeing that a lot in my pediatric population. It's very rare to see a clean medical history now in a child. Yeah. And that's really hard to see, but I think we're in a transition period, which I'm excited and hopeful for. Yeah. But really respecting those bacteria. Yeah.
So that's the number one way. And essentially that involves cutting out the use of really strong foamy toothpastes, like the classic Crest and Colgate brands, ceasing the use of Listerine and other very strong mouthwashes that have a high concentration of essential oils, and switching to a toothpaste that has gentler cleaning ingredients and a much lower load of essential oils.
100%. And people unfortunately think essential oils equate natural and health, but they are very antimicrobial. As we know, you think of oregano, we use that as a strong antimicrobial, or tea tree. They're not really selective, so they're damaging our healthy bacteria too. So you do want to be mindful of that. But also I'm excited because more and more products are focusing on prebiotics and probiotics and amino acids that we're learning that really help modulate the microbiome. And so I think we're in sort of an oral healthcare revolution, which I'm pretty happy about because we've been using toothpaste the same way. Gosh, I think it's been 60, 80 years. I mean, nothing has changed much.
Yeah.
And we're really starting to look at the mouth and dentistry differently, and looking at it from a microbial lens rather than just this, you ate too many candy bars, you didn't use fluoride toothpaste, and you didn't floss. So this is what you get.
So if you were to go through the rest of that list and name the second, third, fourth, and fifth ways to balance your microbiome, would that include things like oil pulling with coconut oil?
Yeah, there's so many. I mean, hydration's really important too, I would say. So you don't underestimate the power of your saliva. So I love people to be very hydrated. We can tell a lot by how someone's saliva looks. If your saliva looks like water, you're hydrated. If your saliva is thick and ropey and foamy and mucousy, you're probably dehydrated. And so you're not having that remineralization protective barrier as much. Plus your saliva is so important for digestion and lubrication. I would say nasal breathing is extremely important too, because that's going to change the terrain. So if you breathe through your nose, you're optimized for humidity and it's cleansing, and there's immune function, and nitric oxide's released in the sinuses. We get more oxygenated through our nose, but if you breathe through your mouth, again, it's going to dry the mouth out. It's going to decrease our buffering capacity. It's going to change the pH. So even though we're not directly crowding out the bad bacteria that way, we're making a home that is not as hospitable by keeping our mouth closed. So if you are a mouth breather, or if you snore, if you find you grind, and that it's such an important thing to talk to your dentist about to try to get to the root cause of.
So just like there's a terrain in the body where someone with a healthier internal terrain, such as, healthier nutrient stores. Let's say that there's two people walking around. One person eats a ton of vitamin C and zinc and B vitamins and all of these nutrients that one would count on their immune system to use in order to fight a pathogen. That person, compared to another person who's very nutrient depleted, has a healthier terrain. And when they come into contact with a virus, let's say, person A with the healthier terrain and nutrient stores would be better equipped and better fueled to fight that virus.
Yeah.
So the same thing is kind of happening in the mouth, it sounds like, where a mouth that is, what I'm hearing, moist, a mouth that is moist because your mouth is closed, is actually going to have more saliva, which is going to be more protective against pathogenic bacteria. Whereas if your mouth is open all the time, or while you're sleeping and your mouth breathing in your sleep, you are going to dry out your mouth, and that dry terrain is hospitable to pathogens.
Correct. Yes. The terrain theory holds true in the mouth for sure. And there's many in functional dentistry and medicine that really think if we don't have a healthy gut, your oral health will be shot too, because of that same terrain theory, because they do communicate so much to each other. So yes, I mean, nasal breathing is paramount. Unfortunately, I have so many families that come in and they seemingly are doing everything correctly. The diet's good, their hygiene's good, they're using the right products, their children are hydrated. But the kids keep getting cavities. And the first thing I think of is, how are they breathing? I think that is missed quite often, although I am seeing more airway dental talk happening, and the curriculum is teaching more about the importance of nasal breathing.
The crunchy moms are on it. The crunchy moms are all about the airway.
Yes, they are, almost to the point where I'd say, hit me up. But I think I don't like fear. I don't like the fear tactics, and I hate anxiety among moms too. So if you have a concern with your child's airway, just take a deep breath, mama. And, you can DM me and we'll help unpack it. But it's an epidemic. It's a silent epidemic. I mean, up to 80% of the population has some sort of dysregulated breathing. That doesn't only mean sleep apnea, and especially women.
Why?
Well, we are changing our facial structure, and jaw structures have changed. So I don't know if people have read Breath by James Nestor. There's a book called Jaws by Sandra Kahn. There's a book geared more to parents called Sleepwrecked Kids by Sharon Moore. But particularly James Nestor's book, he'll speak about the anthropological reason. So our faces, our jaws, our airways are shrinking. If you look at an ancestral human skull, we had these big wide jaws. Our teeth were all lined up, including our wisdom teeth. And now you look at a more modern skull, our midface and sinuses are narrow. Our jaws are narrow. We have crowding. This is why orthodontics is a field. Why is that? The theories are that we don't chew as much as we used to. So ancestrally, we used to chew up to 4 hours a day. And this is literally just 10,000 years ago, not that long ago. Yeah. So you think about we were foraging and, gnawing on roots. And
I would kind of love to chew 4 hours a day.
Well,
I think it'd be really
there
satisfying.
are ways you can do it. I'll talk to you about it. But we weren't like slow cooking our meat all day and in Instapot or a slow cooker. Like we had to work for it, And so form follows function. So when you chew, those masticatory forces go out, and that is causing the bone to expand. Our tongue goes up, it pushes out at the palate. Breastfeeding does this too. And now we chew 4 minutes a day because of Go-Gurts and smoothies, and all these ultra-processed foods. And so it's taken a toll on us. So we've noticed a big change in the human anatomy from the agricultural revolution. We started farming, and then we started processing and milling food in the industrialized revolution. And I mean, we just inhale our food now. And that obviously impacts our digestion as well. There's a lot of downstream effects to that. But this is why we're theorizing we're seeing more airway issues. Plus, there are more allergens and pollutants. People have more allergies. And so they have more inflammation in their sinuses. They have a harder time breathing through their nose. So they become mouth breathers. Humans are obligate nasal breathers. So it's kind of this vicious cycle. And unfortunately, mouth breathing begets mouth breathing. So the more we do it, the more we do it. We lose muscle tone. Your tongue's a muscle. It's supposed to be up at your palate and have enough strength to stay there. The orbicularis oris muscle is supposed to be closed. Your lips are supposed to be closed. But just like if you're not going to the gym and doing resistance training, these are muscles. If your mouth's open, you're going to have weak muscle tone. And so this is when you have to work with different specialists to try to get rehabilitation, essentially, to how you're breathing.
I have so many questions. Well, first I'm thinking about the whole chewing 4 hours. I'm stuck on that first off. I had this thought of I wonder if that's related to the level of oral fixation that we kind of have now in our culture, where a lot of people are addicted to vapes or cigarettes or eating or whatever, whatever it is, snacking, this, that, or chewing gum even. I wonder if it's this evolutionary thing where we know we need to chew more. And that's kind of making us want to soothe by.
And people chew. Yeah. People love gum.
Oh my God.
There's
I'm obsessed.
So many gum habits.
I could eat a pack of gum. And I do in one sitting.
My daughters are so into it. It's what's nice about gum is that it increases salivary flow and it's cleansing of the teeth. So it's helping wash away,
especially xylitol gum. I'm sure not.
For sure, xylitol. Yeah. Not like Hubba Bubba or Big League Chew or something like that with a bunch of sugar in it too. You want to be a little careful over chewing, just because so many people do have temporomandibular joint issues as well. But I think those are newer diagnoses as well because of how our skeletal structure and jaw structure is changing, and stress, and all of these things too. But there's appliances. There's something called a MyoMunchie, which is this little silicone. It looks like a mouth guard that you can put in. I keep mine in my car and I use it during my commute. I'll put it in and I'll chew on it. Yeah. And we love those in kids because it helps strengthen the muscles. So it can help retrain the lips to stay closed. And some of it is a neural feedback loop. Sometimes the brain really forgets how to breathe through the nose. And so we just need to retrain the brain. Oh yeah, that's what I'm supposed to be doing with this organ. The nose is pretty fascinating. It does really neat things. But so it's called a myomunchie. You can check it out.
Maybe all those kids like chewing pen caps were better off than we realized. They were just keeping that feedback loop going.
Yeah.
It must be why we wanted to do, I wanted to put so many things in my mouth and chew things as a kid. I was always chewing on things. And
I remember that feeling too.
Yeah.
And when you're teething too, I think we forget how hard losing and exfoliating teeth are. We appreciate it in our babies, but then, you know, our school age children, when they're losing teeth, it's such a weird process, and they want to chew on things so much to get through that inflammatory process too.
So you said another reason as to why we are mouth breathing involuntarily almost is because we're having more inflammation within our nasal airways, our nasal passage. Mm-hmm. Is this why on planes you cannot help but mouth breathe? No matter what on a plane, I can't take a normal nap. I have to put my head back and mouth breathe to get a good nap in.
You do for sure get inflamed on a plane. It has a lot to do with the CO2 levels too. CO2 levels are really high in planes. I have a little CO2 monitor. I used to carry it around. Now I don't because it creates too much anxiety in me. But all that recirculated air, the CO2 level goes up. It's why many people fall asleep on planes and also feel like garbage, like that brain fog. And it's the same in hotel rooms too. The CO2 levels tend to be really high in hotel rooms because you can't open windows. And so it's all recirculated air. And so that carbon dioxide has nowhere to go. So that's a whole other side point, but
fascinating to know. But the other half of that is that yes, nasal inflammation goes up on a plane.
Also, if you have a high, this is very visual, but your palate really should be kind of flat like this. If I were looking at my palate, if you have a narrow face, narrow jaws, and this is epigenetic, this has been going on for generations. So we can't really totally combat this with breastfeeding and diet and chewing only. But if you have a high, narrow palate, it's going to be bubbled up, right? Vaulted palate. Well, right in the middle of that is your septum. So if it's nice and flat, your septum's going to be straight. But if your palate is high and vaulted, what happens? The only way for it to go is to bend over, and that's a deviated septum. So many people think deviated septum is because I broke my nose during baseball or fell out of a tree, but actually it can be from a high narrow palate too. So if you have this high narrow vaulted palate and then you get expansion orthodontically or with your functional airway dentist, that septum will straighten out and you'll be able to breathe through your nose a lot better too. So it can be structural. So it's either hard tissue or soft tissue, all of these things. So is it the bone or is it the muscles or tissues like the adenoids and the tonsils? Is there a tongue tie that was missed? Is it just a oral motor function issue, a bad habit? Sometimes nutritional deficiencies can impact how we breathe and sleep as well. So
like what?
Like specifically magnesium, vitamin D, and iron deficiencies can really impact sleep quality. So if you already have low muscle tone and now you're deficient in these minerals or nutrients and you have just restless, unregulated sleep, it can just lead to more airway issues as well.
Okay, so what are these like kind of hard and fast signs that someone can start to notice within themselves that, hey, I might have an airway issue and I might be breathing through my mouth too much?
So personally, I would just say, how does your mouth feel when you wake up in the morning? Does it feel sticky and dry? Is there some saliva or wetness on your pillow? You probably are mouth breathing. Obviously, if you have a friend or partner, you can ask them. Are you prone to dry mouth a lot? Try to catch yourself. Like, where is your tongue in your mouth? Your tongue should be up at the roof of your mouth when you're at rest. If it's laying low behind your lower front teeth, you probably have more of that Napoleon Dynamite look to you, the forward head posture, the open mouth, like you're just trying to open everything to get your airway open. If you have children, watch them sleep. Like so many parents put their kids to bed and like close the door and just bolt, you know, for a little bit of freedom.
I can imagine.
Yeah. But I encourage you just go back in and observe them sleeping because you'll very likely notice their mouth is open. You might be hearing them. Kind of Darth Vader breathing or noisy breathing or snoring. And really, unless they're sick, any amount of that is atypical. So you should have a conversation. We should be breathing silently. You should not hear breathing.
what do you do if you're like, I'm mouth breathing at night, I'm snoring, I have a problem? Who do you go see?
Yeah, we can put some references in the show notes for sure. An airway-focused dentist, ideally. So there's different training organizations. The Breathe Institute is a really wonderful one out of LA. But you need to unpack the why. So is it structural, as I mentioned? Is it that you need expansion of your jaws? Do you have enlarged tonsils or adenoids? Do you have a missed tongue tie? Is it just a tone issue and you just need some basically physical therapy or myofunctional therapy? So we need to understand why,
So you can correct snoring.
Oh, yeah. Yeah. So, and it depends too. So all of these sleep issues are on a continuum. So there's sleep disordered breathing. There's dysregulated breathing. I think most of us think of sleep apnea. That's really the worst. And unfortunately, many doctors and dentists are really only looking at that kind of end stage issue, but there's this whole continuum in between. So if you are snoring, we need to understand why. Is there a redundancy in tissue? Is it a lot of times it's a tone issue? And a lot of women, especially in perimenopause, menopause, will have increase in sleep disorder breathing too. And that has to do with stress, and then different hormones like can trigger just relaxation of the muscles. But you want to work with your dentist, and it might take some orthodontics. It might take some kind of physical therapy, myofunctional therapy. You might need to see your ear, nose, and throat doctor. You might need some craniosacral or chiropractic adjustments as well, because this can be fascial related. It can be a neural feedback issue. So sometimes just rebooting the nervous system too. So many of us are sympathetically overdriven, that fight or flight. And sometimes if we can learn to get back into parasympathetic, that can just help us through some of this as well.
A lot of people on social media will say that just mouth taping is enough to fix it.
I mouth tape every night.
What do you do if mouth taping is uncomfortable? Because I don't like how it feels. I kind of feel like I'm choking.
So if you feel like you're choking, that tells me that you have an underlying issue that we need to explore.
Cute.
Yeah. I'll give you tips off camera. If you find panicked and you're ripping it off, that is a sign that you actually have a hard time breathing through your nose. So I don't suggest doing this with children unless they're cleared by your dentist or ENT. But for you, there's mouth taping or lip taping. There is a test that you can do. It's the 3-minute lip seal test. So basically, can you breathe comfortably through your nose for 3 minutes without feeling panicked? That's the first step. So then we encourage people, if they're interested, they can lip tape maybe while they're cooking dinner or they're watching a small show, or try it during a movie. If you're ripping it off, there's something going on. Now, it could just be a nervous system, like just something in that feedback. Your brain just needs to be retrained that this is okay.
Yeah.
You're going to be safe. A lot of us overbreathe. We have dysregulated breathing. And that's why I like James Nestor's book too. He goes in at the end speaking about different breathing techniques. There's breathing rehabilitation. This is actually what I think a lot of airway dentists are missing. We fix the structure, we fix the bone, we fix the bite, we fix the sinuses, we fix all of that, but we never retrain the patient how to breathe. And so many of us have dysfunctional breathing. We breathe too fast, we breathe too shallow. And that's a big component of it. So maybe just some breath work would be good for you too.
That's probably what it is. I always catch myself holding my breath or shallow breathing. Because I do naturally push my tongue up to the roof of my mouth at rest. Even while I'm podcasting, I can feel it. That feels very comfortable to me. And I can sit here with my mouth closed and breathe.
You are. I'm watching.
But when I put the tape on, for whatever reason, my brain is like, it's time to panic.
Yeah. And yours is more neurosensory, neurofeedback. And so breath work is wonderful.
Okay.
Learning that it's okay. When you think about longevity, I mean, I really think it's whoever breathes the least lives the longest. If you think of these monks, some of them are only breathing, 6 respirations per minute. Think about that.
I've thought about that with heart rate before, where I'm like, you live the longest if your heart beats the least.
It has an expiration. So you want it.
How many beats is your expiration?
I don't want to know.
That's dystopian.
You're putting like
Black Mirror.
Yeah, no. It's Black Mirror.
But that makes sense. I guess
Yeah.
it's like the calmer your nervous system,
Yeah.
but then you can get hit by a car. So whatever.
Yeah. But some of that breathing stuff's really cool.
Yeah.
And there's all kinds of breathwork retreats and there's so many apps out there now. I struggle with it too. I definitely overbreathe. I hold my breath too. I notice it when I'm tense or stressed. So it's something I try to work on too. But the breath work is just like anything. You're retraining yourself and it really does work. So I would look into that.
So if you're one of these people that's noticing that you're either mouth breathing or snoring or having some sort of issue where you think that you might not be breathing through your nose as easily as you'd like, you're going to go to an airway trained dentist. You're going to get an evaluation, and it might involve like a jaw expanding orthotic. It might involve physical therapy. You just need to figure out what your root cause is. But first, you can try mouth taping.
Yeah.
And if that does the trick, that does the trick. And if you feel like you need to work up to it, do it while you're cooking, like you said, and just see if you can tell your brain that you're safe and get past the nervous system piece.
Yeah.
first.
And if you can do it safely, you will wake up feeling like $1 million. I will tell you, when I don't lip tape, I feel terrible.
Why is that? Is it you think that your mouth is opening in the middle of the night?
So you get 20% less oxygenation to the brain if you breathe through your mouth. Plus, there's inflammation that happens with mouth breathing too. So dark circles usually is a sign of venous pooling, which is a sign of inflammation. Yeah. So oxygenation obviously is super important.
And like for you, for example, if you feel worse when you're not lip taping, that means that your mouth is opening. Why do you think your mouth is opening?
Yeah, I know. So I had a really bad bicycle accident when I was 10 and I broke my jaws and knocked teeth out. And so everything, and then I had an orthodontist not perform correct therapy on me. So my jaws aren't lined up optimally. And so unless I went in for jaw surgery,
which is a beast,
I will never do that.
It's a beast.
Lip tape is cool with me.
Okay.
I'm fine with it.
All right. So
And now
you're
my
aware of a structural issue and you compensate for it with
I'm
lip
probably
tape.
too aware of it. Yeah.
Okay, good to know. I'm going to try to get back on my mouth taping game. And also, just to bring people back, the reason that we went through that deep dive into mouth breathing is because if you're mouth breathing, your mouth is dry, which means you can get cavities.
Yes. And so many kids come in with cavities, doing everything correctly. And the first thing I think of is, I wonder if they're mouth breathing. And so we go down kind of that rabbit hole. The other thing too, we're seeing more and more in children is undermineralized enamel, which is actually devastating. There's something called hypoplastic enamel. And it's the hardest thing to treat in dentistry. The teeth come in literally sometimes crumbling. Yes. This is my new mission, by the way, is to bring more attention to this crisis, which I really believe
I've heard you talk about
crisis.
This. You said it's a silent epidemic of undermineralized teeth.
It is rare now for me to see a child without some degree of it. And so it's hard to unpack why. And I'm kind of deep diving into some of the research now. I actually have a presentation I'm going to do on this later this fall. But mineral deficiencies for sure. We know our soil's depleted. We're magnesium deficient. We're vitamin D deficient. We're K2 deficient. All of these things impact dental development, either in utero for the primary or baby teeth, or in those very early kind of toddler, young child years for the permanent teeth. But also, and this one's very overwhelming, but I think we need to know about it. There are studies that are showing microplastics are affecting enamel formation. So endocrine disruptors affect hormones. Amelogenesis or enamel formation is a hormone-driven process. And I'm concerned about it. I really am. Because these parents are doing everything correctly, but you have this extremely susceptible tooth. So it's more easily susceptible to acid attacks than it should be. You don't have that enamel armor as you should. And so the kids are getting decay. And then maybe you add mouth breathing to that. It just creates this perfect storm because the tooth was so vulnerable to begin with.
So just to walk back and give people the context of exactly what we're talking about, the silent epidemic that you're seeing of undermineralized teeth is that children are coming in and their baby teeth are or their teeth period are
Could be permanent
so
teeth too, yeah.
vulnerable because they're so undermineralized and they're not forming properly.
Correct.
And this could either be because microplastics are hormonally disrupting the way that their teeth are forming, or because we're maybe in the third generation now of mineral depletion of our soil and our bodies.
Yes.
And when I heard you talk about this on another podcast, I thought it was so interesting that you mentioned that baby teeth start forming in utero around weeks 12 to 17. We see a lot of teeth issues in pregnancy. Part of that is the estrogen and hormones, but part of that is like actual mineral depletion because you're giving it to your child.
Yes.
So if you don't have the minerals that you need for your body and you're not getting any extra through diet, especially, your child could do, try their best at leaching those minerals from your bone, but they just might not be there.
Correct. Yeah.
That's a crazy thing to think about.
I know. It really is. It gets very overwhelming. But that's why I just appreciate being able to speak to this because this comes with education too.
Yeah.
So I think people knowing that these can be issues.
Yeah.
Other things that can cause undermineralization too are, really high fevers in childhood or chronic antibiotic use, some environmental trigger. And some of these are out of our control, but especially now that I'm seeing it in so many primary teeth, the baby teeth. So that means it's something happening in the gestational period. It's concerning. And it can be mild, moderate, or severe. Mild is usually not as big of a deal. The teeth might look kind of white and chalky. And then severe, they'll be brown and orange and mottled, and they literally crumble. And what's really hard for dentists is these teeth are also innervated differently, so they don't get numb. So they're really hard to work on. And these kids, or in adults, they can't eat. Hot and cold foods are really triggering, or even like touching them can be very sensitive. I mean, it's really…
Are they becoming innervated differently due to the deficiencies of minerals?
They don't fully understand that. But yeah, we have all these little tubules with fluids that are in our teeth, and those have nerve endings that come up through them. And so it has something to do with that, most likely fluid exchange, like how it's behaving in that crystalline structure differently.
So you're just point blank seeing differences in the teeth of the kids that come through your office, and you're seeing this get worse and worse over time.
Yeah, and this is anecdotal, but I'm in my second decade of dentistry, and I see a lot of children, and people could say, well, it could just be your practice. But I speak to colleagues all over the world, and it's a similar finding.
So for the parents listening who are either trying to get pregnant, currently pregnant, have a friend who's pregnant, what teeth strengthening nutrients and minerals do moms really need to be focusing on during pregnancy?
I mean, I can't emphasize, vitamin D3, K2 enough. I think so many women are vitamin D deficient in pregnancy. So work with your doctor. I think it's important to know your levels. Then you know how to address it.
How can you find out your K2 levels?
K2 is tricky. K2 is really tricky.
Is tricky because I've heard you talk about before, and I've heard other dentists. I had a dentist tell me, because I'm a tartar calculi girl.
Yes.
And she was like, you're probably so deficient in K2. But I couldn't find out a test. Testing. So I'm kind of supplementing in the dark.
There is a workaround that I'm going to be very honest, that I don't even fully understand. It's sort of… you can piece apart through another metabolic process of elimination. If you're low in this other nutrient, you might be low in K2 as well. And I can include that in the show notes. It's a little wishy-washy with the science.
Yeah. All right. Well, big picture, what we need to know.
So diet would be great with K2. So, fermentable foods, egg yolks. I mean, organ meats, we just don't get enough of those things in our modern diet. So many of us do need a supplement, and I'm pretty supportive of that. But D3 especially is incredibly important. Obviously calcium and phosphorus as well. Try to get all of these things through your diet, but unless, some of it just don't get enough, or we're not absorbing it appropriately because of our gut health and our gut bacteria. And so you can be consuming all the healthy foods, but we don't know if they're bioavailable in your body and how your body's, utilizing them unless you test. And then I would say magnesium is such a huge one. And I see magnesium all over social media now, and I'm so happy about it. So you want a really high quality magnesium blend. I would say also, omega-3s are extremely important too, not only for your child's brain development, but their gum health and their jaw formation and skeletal formation as well.
So to make sure that you're giving your baby in utero the ideal mineral intake to hopefully help mineralize their teeth that are developing, you want to focus on vitamin D, K2, magnesium, calcium, phosphorus, and omega-3s.
And I'd say vitamin A also.
And vitamin A.
Yeah, the fat solubles.
I do take, I'll put a link to this in the show notes. I don't have any affiliation, but Da Vinci Labs does a liposomal ADK. Yeah. And so that's what I take personally because I've always needed some vitamin A support. I don't eat enough liver.
Yeah.
And I have a genetic mutation where I can't really convert beta carotene to vitamin A. So I just supplement it.
Yep.
And I really would never take vitamin D without K2 in the supplement. I think it's not a wise choice. So always look for your vitamin D supplements. Make sure there's a K2 element.
And it's all 3 in 1?
Yeah.
Oh, that's great.
ADK, yeah. And it's just like a little liposomal liquid.
Yeah.
Tastes fine.
Fabulous.
Really good product. So obviously I'm thinking most food sources of these things are inadequate, right? Unless, like, for example, calcium and phosphorus. I'm assuming we can get that through dairy, but not everyone's eating a ton of dairy.
Eat dairy. Yeah. So, I mean, then you say leafy greens, but you need to eat so many. I mean, I do say work with your physician or your provider with calcium supplementation because you can overdo it. It's real tricky. It's real tricky. But, you know, I think, again, it's just being aware and trying to support yourself throughout pregnancy as best you can. That's the other issue. So many of us are nauseous and we're sick and we just can't eat anything but like toast maybe. So, and that's where supplementation can come in. And then making sure that you work with a really knowledgeable dentist right out of the gate. I really like kids to be seen by the age of 1.
Wow. I was certainly not at a dentist by the age of 1.
Neither was I. But that's actually the national recommendation. I like to see babies because I'm looking for tongue ties, lip ties, oral motor dysfunction, things of that nature as well. And we do know education leads to prevention. And so if I catch a family right when their child's teeth are erupting, or maybe even before, you know, when I talk about diet and hygiene and products and breathing and all of these things, we really can make sure that we're on a good trajectory to health because we don't get this information from our OBGYNs or our pediatricians. So where are we learning about oral health? And so many of us have learned about oral health from our parents, who learned from their parents, who learned from their parents. You know what I mean?
My dad just gargles Listerine 3 times a day.
Exactly. My dad, I think, drank it. I mean, it was just like, there was so much Listerine consumption in our house. It was outrageous. That smell, I can't ever forget it.
My dad, to this day, it just smells like aftershave and Listerine.
Yeah.
I'm like, go off.
Like Old Spice.
I don't even know what it is.
Yeah. So it's important to have the tools. You know, it's all about the tools. And I find with families come in early and they educate, and most families are just so on top of it now. We all just want the best for our kids. But once they have those tools, that education, these kids are just set up for success. It's really great. And of course, there's outliers.
I think you have to, like, the only way forward is to instate these habits young. Because it's so much harder for me as a 30-year-old to be like, all right, got to do this 3-step oral care routine that I did not grow up doing, that doesn't feel natural to me. Like, you have to almost re-educate yourself every day and remind yourself why you're doing it.
It's the same for me. I mean, I never flossed until dental school, I don't think, because no one had taught me about the importance of it. It wasn't that I was just being defiant. No one actually sat me down and explained why it was so important to disrupt the biofilm between my teeth. Education is everything. It really is. And I just want everyone to feel empowered. The thing is, too, with starting so early, you're establishing your child's microbiome. So once the microbiome becomes dysbiotic, it gets really hard to correct it.
I see it with my dog. He took 1 round of he was perfect his first entire year of life. He took 1 round of antibiotics and his breath has never quite been the same. His stool has never quite been the same. No matter what prebiotics, probiotics, it gets better. But now it takes those things each and every day to maintain him. It's like, it is so hard to walk back dysbiosis.
It is. The other thing I think many do not realize is we are born our mouths in pretty harmonious balance. Okay. So we are generally inoculated, if you will, with pathogens from our caregivers. And it's going to happen. You know, we share utensils, we kiss on the lips, we, you know, clean the pacifier. Kids are in preschool, they put everything in their mouth. But you get strep mutans, which is the general cavity causing bug. You get candida, which is synergistic, opportunistic fungus that works with strep mutans to just expedite the cavity process, or you get periodontal pathogens from someone. So that includes many times you hear, I never had a cavity till I went off to college. Well, you're exchanging saliva perhaps with people that don't have impeccable oral hygiene. So you get inoculated with different microbes. I know we don't all want to think about these things, but it's true.
Well, and it's like you're going to get exposed to those things. It's part of being a human.
And it's the terrain.
And it's your terrain.
Yes.
It's how much can you support your good bugs so that no matter what bad bug you come into contact with, you don't have to be afraid of the germ.
Yeah. Or your body can handle it so it doesn't overpower your mouth. Yeah.
Okay. I want to just circle back to the dairy piece one more time because I do feel like a lot of people are dairy free nowadays.
Yeah.
And I once was like, well, you know, you don't need dairy. Like, you know, you can just, and then you look at cultures that don't consume dairy.
Yeah.
They consume natto. They consume other sources of K2.
Yes.
So if you're not consuming dairy and you're not consuming really smelly fermented soybeans, you're losing out on crucial K2, calcium, phosphorus, like we said. So I do encourage people, instead of being satisfied with cutting out dairy as a way to manage your gut issues, try to find ways to make your gut healthier with probiotics so that you can handle dairy, and try to experiment with different types of dairy until you find one that you do tolerate. Please don't give up on dairy right away.
Sheep or goat or
sheep,
raw.
goat, raw. It is so worth trying from a really good trusted source. There's like, you know, ask around, ask your people, ask at farmers markets. Do you guys have a source of raw dairy that you trust? And find your local dealer. I have this guy who comes to the house. It
is such an seedy underworld. I mean, we can't get raw dairy in Oregon right now, which is where I live and practice. So it's interesting.
You're getting your raw dairy on the black market. But it's something that if it is a way for you to tolerate it and it's a good source, it is so much more worth it to have that source of all of these minerals. And it's a superfood. Milk is really a superfood.
Oh, it really is. Yes. And we want things from the diet ideally, or, you know, eating sardines and their bones, or, you know, bone broths and things like that. Those cultures that maybe didn't have a lot of dairy, they were still eating a lot of calcium from other sources.
Yeah. Yep. I really like what you said about children should be coming into the dentist by age 1. That like obviously has all these questions percolating up in my mind. I think we should maybe do a part 2 one day on pediatric dentistry.
I would love that.
For moms, and walk through like at age 1, what should we be doing? At age 2, how do we brush?
I have it dialed.
So we'll do a part 2 for the moms listening whose interest was piqued.
I would love that.
But to round out this, I just want to really walk into a little bit about fluoride.
Okay.
Because I have this whole section of
mic drop
questions about like cavities, right? And I think we covered a lot of it. When people hear an episode about dentistry, they're like, "Ooh, cool, I'm going to learn how to like reverse cavities naturally and whatever."
Yeah,
so
for sure.
We can touch on that, and then we can lead into fluoride. When I was listening to you on another podcast, for whatever reason, it clicked for me that a cavity, just like the definition of the word, is an actual hole in the tooth.
That's what it means.
That's crazy.
Cavitation.
It is literally a hole in the tooth. It's I always thought of it as like a black spot or like a blemish in the tooth. It's a hole. And this hole develops because of acid, right?
Yes. The byproduct of the pathogens, when they metabolize fermentable carbohydrates, their byproduct is acid. And so when that acidic biofilm or that acid sits on the tooth day after day after day after day, and there's this imbalance, it leaches minerals out. Now, hopefully, your saliva counters that and remineralizes it naturally, but very often there's an imbalance. And so too many minerals are pulled out, and you can initially just have demineralization, which we'll see as a blemish or a spot or a dark spot, or it'll be, we can even see it on an x-ray, but if you look at the surface of the tooth, there's no hole yet. Those are optimal to remineralize because there's not an actual hole in the tooth. We can't grow back tooth structure. Okay, so if there is no hole, but we're seeing demineralization, that is a perfect candidate to remineralize. If you have an actual hole, you can remineralize it to a degree, but more likely you're arresting it, which means freezing it in time. So that hole will always still be there, but it's not going to progress.
Okay.
Now, sometimes the hole is so big and so deep and so teeming and festering with bacteria, and it's in the nerve or close to the nerve, we have to do a traditional restoration. And this is the benefit of pediatric dentistry is I'm always weighing, well, these teeth do fall out. They're extremely important. And I don't want to leave this child in a state of distress or disbalance. But how close is that tooth to falling out? Do we just arrest it right now and wait for it to exfoliate or fall out naturally? Is it such a small lesion with no hole in it? Can we actually remineralize or reverse it? And I have a whole protocol I can share.
For adults too?
It's all the same. Yep, it's all the same.
So you can actually remineralize, like you said, if it's not a hole yet, you can remineralize the beginning of a cavity.
We do it all the time. I've created protocols based on research and quite honestly, just clinical experience. It is why people do travel or hit me up on social. And I actually have courses and things too. So, but yes, it has to do obviously with understanding the root cause, and we have to correct that first.
So what are these root causes of cavities? Like you said, fermentable processed carbohydrates, eating those frequently throughout the day so that there's always some kind of carb to ferment where acid is made.
Correct. Every time we eat those foods, the pH of our mouth drops. It's part of the digestive process, so our mouth becomes acidic. The bummer about those foods is they're very sticky. So they just stick in the mouth and hang out so those pathogens can feed on them all day. It's like this never-ending buffet of food. I don't want them to have a never-ending buffet. I want them to just maybe be exposed to it and then be done. But unfortunately, crackers and pretzels and chips, think about when you eat those things. They're just stuck all through your teeth. But then it has to do with duration and frequency too. So those foods, you grab a handful of crackers, you go do something, and then you come back and you're like, well, I don't feel satisfied. I'm going to have some more. And before you know it, that bag or box of crackers is gone. So every time you're eating, your mouth's acidic. You're never allowing your mouth a chance to rest. And just like we know how important it is to allow our gut a chance to rest and take a break, the same with the mouth. So we really want to be eating on a schedule. Ideally, every 2 hours is what I suggest. But I really do like to see if kids are starting to get cavities or adults, I really think we needed to unpack your diet and maybe consider really cutting back or even eliminating some of those ultra-processed foods for now until we get things under control.
Would you say diet matters even more than our dental habits if you had to choose one?
Absolutely. If you ate an ancestral diet, and you see these accounts saying, I don't brush my teeth, I don't floss.
I've never seen that. I'm not on that side of Instagram.
I don't know why I am. Help. I'm sending an SOS. I need to unfollow some people. Yeah, they're saying I'm carnivore, so I don't brush or floss. I mean, I could kind of get behind that because meat won't cause cavities. Now, you could get periodontal disease. That's a whole other thing. So I still encourage everyone to floss and brush, please, and see your dentist regularly. You need cleanings. We need to do oral cancer exams are really important. HPV is a thing. It's really concerning. So please see your dentist. But if you ate an ancestral paleo diet, very strict, I would say with limited fruit even, you could argue that you don't need a lot of hygiene. So yes, I say diet is number one. But I'm not saying don't brush and floss.
But even a tenth of that, just even a diet that limits processed food, even where you're still eating fruits and tubers and all the things, you're still having plenty of starch and sugar. You're just not having it in these crackery.
It's the duration and frequency.
Yeah. Yeah. Just a whole food sensible diet goes a long way in terms of cavity prevention.
Yeah. I mean, I know that I generally eat that way. I just don't eat a lot of those snacky foods. I've never been much of a snacker, thank goodness. And I prioritize my protein and all of those things. But because of that, my teeth always feel kind of clean. They just don't have a lot of film on them.
Yes.
But if I do happen like on a road trip and I'm like, oh, now's the time for the Doritos.
You can feel it. There's like some saved in your molar for later.
Immediately, there'll be this film. I notice it too sometimes when I like go to certain restaurants and have pho or a soup and there's a lot of sugar. I'll feel that coating on my teeth almost immediately.
Do we need fluoride to prevent cavities?
No. My answer would be no.
Walk us through your journey as a medical professional who was once physically in the streets picketing for water fluoridation.
Oh, you heard that?
To one who actively speaks out against fluoride.
Yeah, I look back at that. It's very humbling. But I like to share that. So I was trained in a school, like we all are as dentists, that really push fluoride, you know, and I never really questioned it because all the people I looked up to, all my mentors, all the dentists, they just said, this is the bee's knees. This is what we need to keep our teeth healthy. And of course, we only saw cherry-picked science, you know, in that environment. So I was super pro fluoride. I happen to live and practice in Portland, Oregon, and we do not have water fluoridation. It's just never passed. And I think it was maybe 2010 or 11, and it was up for vote again. And I was in my pediatric residency, and I was very vocal about the fact that we needed water fluoridation because look at all these kids with cavities coming in. It's rampant. It's the #1 chronic disease in the world. It's an epidemic. And then I had a professor come in who had been to the debate downtown, and he kind of sat down. He looked really just in shock after his experience hearing kind of both sides. And he said, I think you guys all need to hear the other side of the fluoride debate. I had never heard or even understood half of the things they said, and I'm going to go do more research. And so, and he had been super pro fluoride, and it was someone I really looked up to. So I said, what is he talking about? So I started to just do my own due diligence. And I realized, wow, fluoride has a lot of concerns. It's an endocrine disruptor. It can be defined as a neurotoxin. It affects the thyroid. It's antimicrobial, so it's killing good and bad bacteria. You know, what is it doing to brain development? And just since then, there's been so much more science and data coming in about how it is impacting the fetal brain development and the brain development of our children, affecting IQ. Some very great studies. There is a lawsuit. It's a federal lawsuit. All the testimonials have occurred, and we're just waiting for the judge to rule. It literally could be any day. But it was the people versus the EPA. And basically, there's never been any solid, safe, long-term safety studies on water fluoridation. And that's also a medical consent issue as well. So we're mass medicating people without their consent. Now, the thing specifically with water fluoridation, so this is systemic fluoridation, right?
Yeah, you're ingesting it on a regular basis.
So this could also include prescriptions, so fluoride prescriptions that your pediatrician might write for you. We know this is not up for debate. Like even dental schools are teaching this now, that fluoride works topically, not systemically. And what does fluoride do? It makes the tooth more acid resistant. And that is true. It does. But as a functionally minded dentist now, where I'm looking beyond the tooth, what is it doing to the rest of the body? And that's where I think we're really missing the mark in dentistry. We're so blinders up. We're so focused on that technician part where we're just fixing the tooth. We forget there's beyond the tooth, there's the tongue, there's the mouth, there's the child, there's the parents, there's the family, there's the community. So, there's a lot of concerns. And so the study that gets spoken about a lot was a prospective study where they followed, I think it was 516 mother-child pairs. It was in Canada. The editor-in-chief of JAMA Pediatrics has done a podcast on this. And essentially, They did urinary analysis of fluoride through each trimester, and they averaged the results. And they found that women who consumed more fluoride, quote unquote, in excessive amounts, but what was normal just through their water and through their food, their children had a 5-point drop in IQ. So they followed these kids until they were 3 or 4 years old. It was mostly with boys. So they really did a great job taking out all the confounding variables. And this study is really well recognized, which is why JAMA Pediatrics reviewed it. And they even said at the end, that's on par with lead, that IQ drop. And so to me, I just think the burden of proof should be on the safety of it, not the opposite. And it's just the dental community is obviously very on board with fluoride. But my argument is prove to me it's safe. Show me the safety data, not the other way around. They're saying, well, show me it's not safe. And I just think we've really mixed that up. And so then you talk about topical fluoride, so in toothpaste. Now, if you're going to use it, I much prefer you use it that way. And just a tiny amount, but you have to make sure your child's spitting. So I wouldn't use it before the age of, ideally like 5 or 6 until they're really good at spitting. But even then, how much is being ingested? How much is being absorbed through the oral mucosa? We know a lot of things are absorbed. Like think of a lot of medications. A lot of our liposomals are taken through the floor of the mouth. And so we don't fully understand what the cumulative effects are. The other issue is I think we're all different. And so some people may do okay with that minor toxic load day in and day out. And some people who maybe are a little more susceptible genetically to environmental toxins, they might not do as well. And so I have concerns with it. I can't look a parent in the eye and with absolute certainty say, yes, this is safe for your child.
Is fluoride even FDA approved as a cavity prevention measure, or is it just an acid?
It's FDA approved. I feel like most dentists don't even know this. It is not FDA approved for cavity prevention. The FDA seems like they're staying out of that whole, those claims. It is approved as a cavity liner, which means you use it underneath a filling, which no one does, by the way. And it's used as a desensitizing agent. So if you have a lot of cold sensitivity, you can use it because it helps with sensitivity, which it does. So it's being used off-label. And fluoride prescriptions are not FDA approved either, and yet they're being prescribed every day. So
Why is the American Dental Association so gung-ho about fluoride?
That's a great question. I don't have the answer to that. I mean, I could give you my snarky thoughts.
Well, it's my brain just goes like, if it's not effective, why are...
Well, it is. It does reduce cavities
because of the acid resistance. Okay. But I would also say this. I see plenty of cavities are still the number one chronic disease globally in the world, even with fluoride. Yeah.
And most countries are using fluoride toothpaste. Now, we are one of the only countries to still fluoridate our water.
Yeah, that's just a different...
Many people don't realize that, though. We are one of the last countries to fluoridate our water. I think only 3% of the developed world right now is fluoridating the water. 3%. So, so let's just take out the systemic fluoride just topically. Okay, if fluoride toothpaste was the answer, why aren't we seeing more caries reduction? We're actually seeing cavities go up again. Well, the answer is big food. Yeah. I mean, it's our diet. Fluorides cannot compete with our processed food.
I also heard you talk about how fluoride can actually make your teeth more brittle and change the integrity of your enamel crystals.
Yes, the crystalline structure. So fluoride. So we have hydroxyapatite in our teeth. It's calcium and phosphorus crystalline structure. When you add fluoride, it kind of changes that into almost like a Franken tooth, if you will. It becomes fluorapatite, and it is more resistant and durable until it's not. So if you get too much of it, it actually can change the crystalline structure to be more wave-like. So instead of straight crystals, wavy. And that can make it break down more easily. Or there's something called fluorosis that you'll hear of and see.
I have it on my teeth.
Yes, it's very common. They now estimate up to 40 to 60% of teenagers.
What is fluorosis?
So you've gotten too much fluoride during the developmental period of your teeth to the point where it's actually changing the crystalline structure so much it changes the way light reflects off from it. which can actually make it more brittle in theory. You know, there's mild, moderate, and severe. Mild is usually pretty benign except for aesthetics, although
But it appears as these bright white spots.
It's bright white, but once it gets more severe, it can be brown, chalky. It kind of looks like hypoplastic enamel, what I spoke of earlier, or like orangey, and the teeth can be very aesthetically challenging, I would say. But if it's doing that to your teeth, that means there's some anomalies in your bone structure too.
When I heard you talking about this on a podcast, I'm like, damn, my bones are probably just as white as my 2 front teeth.
You might have some white spots.
Wow. Okay. So you said our teeth have hydroxyapatite in them.
Yes.
Is hydroxyapatite equivalent to fluoride, or even perhaps better than fluoride when it comes to cavity prevention and remineralization? Yes.
The data is showing yes. And there is a lot of attention being thrown at hydroxyapatite right now. But yes. I can speak clinically to its benefits. Clinically, I will tell you anecdotally, my experience is it far outperforms fluoride. I think it's because fluoride is carpet bombing your mouth and impacting your microbiome in a negative way, because fluoride is very antimicrobial. Hydroxyapatite does the opposite. It actually can help modulate and create a healthier microbiome balance. So basically it's calcium and phosphorus. It's a mineral-based toothpaste. You'll see more and more about it. It's a little bit of the wild, wild west because we still want to make sure we're providing safe products and safe sourcing. And so you do want to be very mindful about where the hydroxyapatite is coming from and the manufacturing processes, just like anything, just like your supplement. Do you want to get fish oil, from the pharmacy where maybe it's rancid, or is it really high quality? So it's the same thing. So there's some consumer education that needs to happen. It's not FDA approved yet. I suspect it will be, but it might be similar to fluoride. They may never approve it for cavity prevention. I think they're just staying away from those claims, but they might approve it for desensitization. The good news is the American Dental Association did approve a CDT code, which is an insurance code, at the first of this year for hydroxyapatite varnish. Weirdly, insurance companies are still mostly denying it. This is the way these codes and insurance works. The system's such a mess. But the point is, if the ADA kind of approved that code, they have seen the science and they are standing behind hydroxyapatite.
Is that like the fluoride bath that we used to do as a kid? Like, when I was a kid, I would get this interesting tray, bubblegum flavored. Why?
It had a lot to do with contact time. So it's a much higher concentration for, usually 1 to 3 minutes. They just wanted it to sit. So it's really sticky. The concern with that is not only the extremely high dose of fluoride, but all the other garbage that is in there. Fluoride varnish, for example, a lot of them have polyurethane derivatives and adhesives and things in it. That's what makes it sticky. Is
this hydroxyapatite varnish that they approved an alternative to those trays?
It would be. Yes. So it's basically the material, instead of being a fluoride-based varnish, it would be a hydroxyapatite-based varnish. But they don't define or specify what other ingredients are in there.
Okay. All right. But at least they're saying I'm approving hydroxyapatite.
They're saying, it's very telling that they've looked at the science and said, yes, this actually does remineralize teeth. And that is part of my protocol at my office, is for small lesions, or ones that might be more medium-sized. And this is where you really, I don't want you doing this on your own. You need to be working with a dentist, but we have a protocol where we use nanohydroxyapatite. Nanoparticles are just smaller, so they really get into those defects and that demineralization in those tubules better than you'll hear microhydroxyapatite. So we use a nanohydroxyapatite toothpaste, and we use ozone oil. And so ozone kills the bacteria, the pathogens. It will kill some good bacteria too, so we want to limit its use, but it doesn't overwhelm the commensals. It really tends to target gram-negative gram-positive anaerobes. So that's a protocol that we use at our office, as well as cleaning up the diet. And then we want to make sure we're feeding the good bacteria, so the prebiotics, and maybe we'll throw in some probiotics and to the mix as well. But we see a lot of cavity arrest, reversal, and healing with these protocols. So I'm avoiding so many fillings and sedation and anesthesia visits with my patients.
So people can feel good about using a nano hydroxyapatite toothpaste as a complete alternative for a fluoride
toothpaste. Yes. My children are 8 and 10. They have never used fluoride. We've only used hydroxyapatite. I personally haven't used fluoride now for almost 25 years. I've never have had a cavity because, again, it's not about the medicament, it's about the root cause. So what is really creating the imbalance? It's your diet, it's your breathing, it's your gut health, it's your microbiome. It's not what's in your toothpaste. Now, unfortunately, we need a remineralizing toothpaste, most of us, because of our modern diet, so I do suggest that. But again, this is anecdotal, but I will tell you the kids at my office who use specifically nano hydroxyapatite toothpaste that is made from a quality manufacturing facility, they are healthier. And many of their parents come in and even notice the difference. Their teeth are brighter, whiter, less plaque. They just get really great dental checkups. So, but the data is there to support it too. And there's more research and more clinical trials, and there's more comparative analyses and things coming out too. We're really kind of in the infancy of this movement. And so I'm excited to see what the next few years bring. I promote it in my office.
On the cutting edge.
Totally.
I think our listeners are always down.
Yeah.
So with that being said, as my last question, just like hydroxyapatite is this like newer, safer, cutting edge alternative to fluoride, what are other kind of cool advancements that we need to know about and advocate for?
Yeah.
Number one, like when it comes to fillings, a biological dentist that I saw, I had to get a fill a few years back, and he was like, I'm going to do a BPA free composite.
Yeah, ceramic based probably.
Okay.
Hopefully. Yeah. Yeah. So obviously the best dentistry is no dentistry, but if we have to have dentistry, we want to use biomimetic materials and the cleanest materials that we can. And so you do want a BPA or BIS-GMA free. Unfortunately, just like with the water bottle movement, BPA free became kind of a marketing thing. There were still other plasticizers in some of these plastics.
In fillings?
There can be in fillings, but there are ceramic-based fillings. Like most biological dentists are using those. Okay. So they're really high-quality fillings.
So should we be asking for BPA-free ceramic fillings?
I would.
Okay.
I'll probably get a lot of hate from some dentists on that, but just because it's something else they have to order and it's more expensive. But that's all I use at my office.
Would it be longer lasting?
It's amazing. It's all I've been using in my office for almost a decade.
That's incredible.
Yeah.
What about peptides?
Yeah, cool. This is actually an area that I'm just getting interested in, but there are some studies where they're using peptides to regenerate tooth structure and even heal the nerve of our teeth. So a lot of endodontists are using it in pulp capping to avoid root canals. So I am by no means an expert in this because it really is in its absolute research infancy, but keep your eyes out for that. Peptides being used. I mean, they're basically being topically placed within the tooth. And then I do think there's more studies about actually, using them locally in injections and things too, to help support collagen synthesis and regeneration of tissue.
So this is not Ozempic for teeth. This is different peptides.
I hope not. That's a whole other topic. And also look for someone with ozone. I love ozone. If your dentist is using ozone, that really can help if you have gum disease, periodontal disease. We see a big shift in the oral microbiome to the better with using ozone in the kids. And then laser dentistry is really cool too. So we get rid of that drill.
Really?
Oh yeah, I use a laser for all the fillings with the kids, and they don't need an injection or a shot. No,
I mean injections don't work on me anyway. I need like a horse level of lidocaine. Yeah,
that stinks.
I mean they do sometimes, but
yeah. So obviously that's the hardest part of the dentist for most people is getting an injection in your mouth. I mean it's the most stressful part for me. It's so funny. I occasionally wear a continual glucose monitor just to check in. And when I first started, I would notice I would spike out of nowhere in the middle of my workday. And I was like, what is that? I wasn't even eating anything. It was stress. And it was right before I would give an injection.
Oh.
Isn't that crazy? Be nice to your dentist.
Oh my gosh.
Yeah.
You did not want to give those kids an injection.
You're stressed out.
So there's like laser. This is like for a whole other episode. But there's laser dentistry where you could do a filling with a laser instead of a drill.
Yeah.
Got it. You're living in the year 3000.
Yeah, it's cool.
Okay. Actual last question is, can you just like give us a very quick walkthrough of like your AM and PM oral routines? We can just get an idea of what we should be doing.
Yes. I'm sort of less is more. I'm not into the 50-step morning routine because I just don't have time for it. But very often I will wake up and I will oil pull with a raw organic coconut oil. I will swish it around for just a few minutes. I don't do 20 minutes as I'm like tidying up my room and like organizing my clothes for the day or something like that. I spit it into the trash can. I usually then go out. I drink a bunch of water with electrolytes. I might take some supplements. I will start my tea or my coffee depending on how I'm feeling that day. I tend to eat a later breakfast.
You don't brush your teeth after oil pulling?
Not immediately, I don't. I'll walk out.
Why?
I think it's just how it works for my routine.
Huh.
So it's kind of coding.
So you don't brush your teeth right when you wake up?
I don't.
Should we not be doing that?
This is the thing. Everyone always asks me for the perfect routine. There really isn't one. So I will oil pull. I'll go pitter patter around the house. Then I go back into my bedroom and then I tongue scrape. I floss and brush. I do not expect everyone to floss in the morning. Wouldn't you,
if you're doing the oil pulling and the drinking water before brushing, wouldn't you be drinking water and drinking bacteria from the night before?
You are anyway, though. That's the thing. You know what I mean? So I spit it all out and I might do a quick rinse with water, but I'm not brushing my teeth right away.
Wow.
Yeah. That doesn't resonate for everybody, but this is what I do.
No, this is
And I don't oil pull every day because lauric acid is antimicrobial. And so we don't want to be stripping the healthy bacteria. So I only oil pull a couple days a week.
Okay.
So the days I don't, I just wake up. I don't brush my teeth right away because I just don't feel gross. My lips have been closed all night. I feel very hydrated. I haven't had anything to eat. So I'll go pitter patter around my kitchen. And then I tongue scrape, floss, and brush. That's really all I do. Tongue scrape, floss, brush. I tongue scrape twice a day. I floss twice a day. I don't expect all humans to do that.
Okay.
So I would encourage at least flossing at night and maybe tongue scraping once a day, what works for you.
When it comes to flossing, are the little like handheld plastic flossers enough? Do we need to use actual rope floss? Or is water picking enough?
It sort of depends on your health. So if you're really healthy, if your gums are healthy and you don't have signs of periodontal disease, I would say just straight up flossing's fine. I think the picks are fine. A lot of people have a hard time getting their hands in the mouth. Their dexterity's off. Traditional flossing's tricky. If you can use string floss, that is my preference, but have someone show you how to use it. This is the other thing. Like, our parents taught us these things, maybe, or maybe they didn't. We just had to figure it out for ourselves. Your dental hygiene team, your dentist, they want to show you the proper technique. So have them show you because there is a technique of how you want to be flossing with string. But if you have disease, gum disease, periodontal disease, I also like to add in water picking or just for extra credit too. You could do it. So you can alternate. So personally, what I do is I do switch up flossing and water picking. There are things you can add to the reservoir of your water pick. You can add baking soda, a little salt. There are other agents. If you have active periodontal disease, I would encourage you to work with your doctor on these, but you can add like grapeseed extract or certain essential oils for a limited time just because we're trying to target specific bacteria and microbes. Some patients will add in iodine or biocidin even. I've heard patients doing
for
that.
For periodontal disease. Yeah, because there's already like such a massive overgrowth that you do want to cut that back. Just like with the SIBO stuff, you want to use some antimicrobials for a short period of time and then start your more probiotic mouth regimen.
Exactly. And so that's why these things like essential oils, antimicrobials, they do need to be monitored and used for a short period to get us back into balance, but not indefinitely.
I love that. Wow, so much to digest. I feel very motivated to just do my routine to the maximum capacity. And you recently sent me your toothpaste from Feed Your Good Guys, which is a nano hydroxyapatite toothpaste that doesn't have harsh essential oils. And I absolutely love it. So please share with us where we can a little more about that.
Yeah, it was a labor of love. Dr. Mark Bahuna of Ask the Dentist and I, we became fast friends on the gram. And we were frustrated with the current oral healthcare products. And we tried to offer consulting and advice to some brands that we liked to say, hey, I think you should take this out, or how about supporting the microbiome in a different way? And no one would listen to us. So one day we said, gosh, why don't we just make our own? And so we did. It's called FIG. It's FYGG. It stands for Feed Your Good Guys, because that's what I like to say to the kids. But I also think it's really good education to say we want to support the bacteria. It has the only safety approved nanohydroxyapatite on the planet, which is nanoxam out of Portugal. So we feel very great about that. But it also has, more importantly, I think, prebiotics and amino acids to support the microbiome. And we have a lot of other cool stuff coming soon as we learn more about science and technology in this realm. And I actually have a discount for your followers and your listeners. It's Organic Olivia 20.
Love it. I'll put that in the show notes. Organic Olivia 20. Feed Your Good Guys Fig toothpaste. And then where else can we find you?
Yeah. So I'm on Instagram, Dr_Staci, doctor spelled out, DOCTORSTACI with the underscore between. People can come see me in person. I have people that do travel to Portland, Oregon. I'm at NOPO Kids Dentistry. It stands for North Portland, which is where I work. And then I have a website with more guides and courses and support. And it's drstaci.com. Doctor also spelled out.
Beautiful. I'll put all that in the show notes.
Cool. Thanks.
Thank you so much for being here with us today.
Yeah, it was super fun. I appreciate
the coolest. I love the fluoride rant.
I get in trouble.
Wasn't that great?